Have you ever felt like there are just too many medications and side effects to memorize in nursing school? You're not alone. One of the biggest mistakes nursing students make is trying to memorize medications without really understanding the major side effects and nursing implications. So today, I'm going to walk you through some of the most commonly tested medications and the side effects that nursing instructors and the NCLEX love to ask about. Let's simplify pharmacology. Let's start with ACE inhibitors. Common examples include lisinopril and ramipril. These medications are used for hypertension, heart failure, and kidney protection in diabetes. Here are the big side effects you need to know. First, dry cough. This is one of the most commonly tested side effects, so don't overlook it. Second, hyperkalemia. You want to monitor potassium levels carefully with these patients. And third, angioedema. It's rare, but it can be life-threatening. Here's your NCLEX tip for ACE inhibitors. When you see an ACE inhibitor, think cough, elevated potassium, and swelling in the surrounding tissues. Keep that association in your head, and you'll be ready for any question they throw at you. Now let's move on to beta blockers. Common examples are metoprolol, atenolol, and propranolol. Beta blockers are used for hypertension, dysrhythmias, heart failure, and angina. The major side effects to know are bradycardia, hypotension, fatigue, and dizziness. So you want to monitor heart rate and blood pressure closely with these patients. And here's your NCLEX pearl for beta blockers. Always check the heart rate before administration. And remember, hold the beta blocker if the heart rate falls below the prescribed parameters. What is furosemide? It's also known as Lasix. Furosemide is a loop diuretic and one of the most frequently tested medications. It is used for heart failure, fluid overload, and hypertension. Major side effects are hypokalemia. This is huge. There is also dehydration, hypotension, and ototoxicity, which is damage to the inner ear, especially with rapid intravenous administration. Here's a memory trick. Lasix lets fluid leave. Unfortunately, potassium often leaves too. Let's talk about digoxin, also known as Lanoxin. Digoxin is a classic NCLEX medication. It's used for heart failure and certain dysrhythmias. Major side effects include digoxin toxicity. So watch for nausea, vomiting, anorexia, confusion, and visual disturbances. Here's an NCLEX alert. Yellow-green halos around lights are a classic sign of toxicity. Let's proceed to heparin. It is used for prevention of blood clots and treatment of thrombosis. A major side effect is bleeding. Monitor for bruising, hematuria, which is bloody urine, GI bleeding, and bleeding gums. An antidote for heparin is protamine sulfate. Know it. Next is insulin, which is one of the most important medications in nursing. A major side effect is hypoglycemia. Symptoms include sweating, shakiness, confusion, irritability, and tachycardia. An NCLEX tip is low blood sugar can quickly become an emergency. So it's important to know and recognize the symptoms. Let's move to opioids. Examples include morphine, hydromorphone, and oxycodone. A major side effect is respiratory depression. Also watch for sedation, constipation, and hypotension. Here's an NCLEX alert. Always assess respiratory status before administering an opioid. Corticosteroids are next. Examples include prednisone and methylprednisolone. Major side effects include hyperglycemia, increased infection risk, weight gain, and mood changes. Here's a memory tip. Steroids suppress inflammation and immune defenses. Let's move to anticoagulants. Examples are apixaban, rivaroxaban, and warfarin. Major side effects are bleeding. Nurses must teach their patients to use soft toothbrushes, report unusual bruising, and monitor for bleeding. Let's review quickly. These drugs may cause the following side effects. ACE inhibitors, dry cough. Beta blockers, bradycardia. Lasix, hypokalemia. Digoxin, visual changes. Heparin, bleeding. Insulin, hypoglycemia. Opioids, respiratory depression. Steroids, hyperglycemia and infection. And anticoagulants, bleeding. In summary, you do not need to memorize every possible side effect. Focus on the major side effects that impact patient safety. Those are the ones most commonly tested in nursing school and on the NCLEX. Understanding the medication is always more powerful than memorization alone. If this video helped simplify pharmacology for you, please like, subscribe, and share it with another nursing student. Thank you for watching, and I'll see you in the next video.